All right, good afternoon, everybody, and thank you for joining today's webinar. Today we're talking about a webinar called Finally, a Solution to Access Patient Data During Downtimes, featuring Interbit Data's founder, CEO, and president, Arthur Young. We're going to keep this webinar within the 45 minutes we have scheduled, with about 30 minutes for the presentation and then 15 minutes for a Q&A at the end. Just a couple of housekeeping notes here before we get started. Up in the top right-hand corner of your screen, you'll see little letters that say Q&A. So if you'd like to ask a question, you can click there and a text box will appear. You can type your questions right in there. And we're going to save all of those questions until the end, and Arthur will address them all at the end of the presentation. Additionally, all participants' lines will be muted during today's presentation. So I think that is everything that we need to know to get started. So now I'd like to introduce you to today's presenter. So Arthur Young earned a Master's of Social Work, followed by his MBA at Washington University in St. Louis. And he has more than 35 years of experience helping to address data challenges in and around EMRs, including the past 23 years as the founder, CEO, and president of Interbit Data. So one fun fact about Arthur before we get started is that he actually just shaved off his beard very recently for the first time in about 35 years when going to the barber became a little bit more difficult with COVID-19 and everything going on there. So we have, this is our before shot and we have an after shot to show you as well. Great. So that is everything for me. And now I will turn things over to Arthur for our presentation.
Thank you very much. And thank you everyone for coming today. I hope you'll find the information informative. What we're going to talk about today is the issue of downtime, and we'll focus on a couple of our customer experiences. One having to do with the migration from one system to another. But before we get started, I think it's important, in this day and age, we have, many times we use one set of words or whatever to define multiple things. To us, the simple definition of downtime is when I, as the user, can't get to the information that I need when I need it. You know, in IT, we're often looking at the causes of downtime. You know, is it the system is down, the network is down, or whatever? But our application is used by the end users, and to them, ultimately, they don't care what the reason is. The fact is that they need access to information. And so that's what we use as our definition for downtime, and that's what we try to address. Now, you know, you've all been in the industry for a while, and there are a wide variety of downtimes, as I say, you know, based on the cause or the circumstance. There are planned downtimes, so you know, frequently it's maintenance issues or building out structures that may require certain the systems to be offline for a period of time. And what we do is we prepare for that as best we can. Maybe we do it off hours, and certainly we identify that key information that we're going to need in order for people to continue to do their jobs, and we try to make that available to them so that they can continue to operate during that downtime, however long it is. Now, unfortunately, even those planned downtimes can run into or become an unplanned downtime. You've planned for an hour's downtime, and sometimes, well, it turns out to be 6 hours. So, you know, the requirements may be a little different, but there are other causes of unplanned downtimes, you know. system crashes, network outages, and again, our networks are getting more complicated where we may be in a shared data center, which is somewhere else. So we have a connection to that, and then a connection from our desk to the communications equipment, to many points of failure that are possible. And our planning for unplanned downtime is, this is where our NetSafe product comes in. But basically, you have to be anticipating this. You have to have a strategy. What are you going to do? And again, what is the key information? And a lot of times it's, if you have that key information in a centralized location, part of your plan is how are you going to get it out to the people who need it. Now, a special type of unplanned downtime is actually a disaster. And that is something that, is going to potentially disable portions of your infrastructure. We have a hospital near us in Massachusetts who actually had a flood in their computer room. And actually, at this point, the hospital has been closed for a period of time because they don't have, they're not able to access their systems or automate their processes. And again, so the preparation for a disaster has to be not only making sure that you have some copies of information, but in fact, it requires a level of redundancy because you don't know, if you planned on having printouts in the computer room in case of an unplanned downtime, well, your computer room is underwater, so that's not going to work. So there has to be another contingency. And again, the overall issue is, what are you planning to do in these hopefully unlikely events? But you need to continue to care for the patients who are in-house and to anticipate other issues. Now, in the last several years, cybercrime is becoming more and more prevalent, or people are hearing about it more and more. And unfortunately, even as COVID challenged our healthcare network significantly, cybercrime incidents actually increased as well. And cybercrime, I point out as a different type of downtime because some of the strategies that we might use to protect ourselves from a standard downtime may not be workable within a cybercrime. So in the example of like a ransomware attack, you can have planned to have information in different locations to be accessed, but all of a sudden in a ransomware attack, your PC and your network are paperweights. I mean, you cannot do anything. They are locked out unless, you comply with, the requirements of the attacker. And even in other types of cyber attacks, you need to be very cautious of networks, because networks is how these malevolent products are spread. And one of the first strategies is you want to disable the network. And so you need to ensure that level of security and prepare yourselves for it. You're probably aware of many of the challenges to downtime. I mean, first of all, when we're challenging people to do things differently than they usually do, it's more stressful, it's less efficient. the productivity is there. Even in our best policies and procedures, there's still going to be a stress. Again, if we're changing the way we do things and we're changing the information that we may have to act on it, it's going to challenge patient safety, and it's going to create potential for different kinds of errors that might have been caught through our existing workflows, or even through the automation that, that nagging buzz or whatever that the computer would tell you when an error is entered. The other variable today is we're looking at patient experience and reputation, and those factors are going to actually impact your overall reimbursement rates, and certainly downtimes, especially a prolonged downtime, or the impact of that may in fact impact those ratings, and may actually create a potential liability for you. The other thing, as I mentioned, the hospital nearby, they've actually had to close their doors. So, they are losing revenue because of the impact of a downtime. And last of all is the additional impact to our users. We and the government have spent literally billions of dollars in the last several years increasing the utilization of the system, creating new workflows, getting people trained as to how to interact with the systems as an integral part of their workflow. Well, that's the positive side, is all the benefits and communication and all of that. The negative side is that we actually create a dependency. How do you do your job when the system's not available? And I know for many years, the hospital would spend large sums of money to maintain all of their forms and make sure that the forms were everywhere on the floors. I think that people are looking, even as a cost-saving measure, to be spending less in an area where they're not going to be using it that much. But again, what do you do now if the system's not available? So it's an overall challenge to the system. So as we indicated in the invitation and elsewhere, what we want to do is talk about at least one of our customers who brought us that unique situation of identifying downtime requirements in the process of their migration from one computer system, Meditech, to another, Epic. Okay, so this customer of ours, and again, they've requested to remain anonymous, and so we're not using their name. But they're a large hospital system, five hospitals serving multiple communities, many clinics and service areas, and they are migrating, or they have been migrating from a fully implemented Meditech system to a fully implemented Epic system. Now, Epic, I've been in the industry as it was identified for a long time, and the fact is that there are good systems out there, but it's very hard to be all things to all people. And even, the Epic system, which has an excellent reputation, has coverage and has focus in many areas. Unfortunately, there are gaps, and there are gaps in a sophisticated environment where departments may be relying on third-party systems in order to provide care. So even though Epic has its own downtime solution, its downtime solutions are focused on their core applications. What the hospital found is that, and specifically, they had a blood bank system that they found that they were left without a real downtime solution that would allow their ORs to continue operating in case of a downtime, which obviously, if you have patients in there, that you're going to continue with the operations. And if in fact they need additional units of blood or whatever, you need to continue that operation, and you don't have any time for delays. And that's really what they identified, is that their core systems were protected, but really when they looked at the entire patient journey and the requirements, the information requirements, in order to meet the needs of all the departments, they found, at first, they found, blood bank was a significant requirement. Now, since they had been using our system for a long time in their old environment, they recognized that we had the ability to capture the information that they would choose, which has to do with all the blood that had been cross-matched and all of that, and the requirements that the different patients have, and all the information, and they can store that. Actually, we can capture and update a database with all that information, and that information can be available in each of the ORs as well as in the blood bank itself, so that during the process, whether the host system is up or not, they will have that information on their local machine in order to search for the information that they need. And really the success of this intervention has led them to look at the needs of other departments or even other locations, because part and parcel of our downtime solution is the ability to make sure that it is present wherever you want it to be present. And so, now they're looking at other, non-core applications that they rely on, and even other locations that may not be connected into the core downtime system, that they can utilize our system and basically to ensure that they will have access to that information no matter what's going on in their IT environment, whether there's a downtime, whether there's interruption in network, whatever. We are maintaining that information in an encrypted format local to where they are, where we are maintaining audit trails, and we are able to give them that information even when the system is not available. So that's one story. Another case study, this has to do with Hancock Regional Hospital in Greenfield, Indiana. Now, a couple of years ago, I think a year and a half a show on 60 Minutes, which was starting to talk to people about the rise of ransomware. And in fact, Hancock was hit by ransomware and was interviewed extensively during that story. And they talked about how immobilized they were, and how the challenges they had to, to continue to provide care for those patients who were in the hospital, as well as to be able to process the other operations, whether it's outpatients or scheduled patients. So when we started, we were looking for beta sites for our NetSafe cyber solution. They volunteered, and basically what our cyber solution does is it utilizes the core elements of our standard NetSafe of making or collecting the information and making it available to users. But what we do is we put it into a hardened environment, which is entirely separate and not attached to the hospital network, so that it will not, in fact, be subject to the same sort of attack that may immobilize the rest of the system. And with its placement in the computer room, as well as a portable device that you can move somewhere else, but it's placed in the computer room behind its own firewall, removed from the network, but it can be accessed there. And even if the rest of the system is immobilized, it will be available there. So, as they say here, NetSafe is one of the tools we hope never to use. And we agree, although we want to be sure that, the hospital can rely on it. Now, another thing to talk about is the fact that, we've recognized that the COVID-19 pandemic has challenged the healthcare environment greatly, and it's challenging you perhaps to create new areas to provide care. I mean, we've heard talk of hotels, college dorms, parking lots, civic centers, whatever, that there has had to be different locations created in order to ensure patient care can be provided in a safe way. Well, our NetSafe provides that additional level of security. So even if the connectivity with those locations is challenged, we basically have made available to our customers, and we'll offer it to any of the participants of the webinar today, the ability to place NetSafe data in the cloud on a fully HIPAA compliant website with all the security available, but that way people can go from whatever location they're at using our web client and access that information wherever they are to ensure that connectivity or another mechanism of connectivity for needed patient data. Again, if people want to take advantage of that, they should contact us. But, we have been in this business for 23 years, and we have dedicated ourselves to serving the healthcare market. We have installations of our products in most of the US states and many of the Canadian provinces and elsewhere in the world, in all kinds of environments, in all sizes and shapes. And, we are committed to success, reliability, and ensuring that our customers and users get access to the information as they need it. So that's my spiel, and I guess I'm going to hand it back to our moderator for questions.
Great. Thanks so much, Arthur, for that presentation. We are going to open it up for questions now. So again, you should see somewhere in the top right-hand corner of your screen for Q&A that you can click on and enter your questions in that text box. We do have a couple of questions that have come in over the course of the presentation, so I'll get started there. Our first question for Arthur is asking, don't most EMRs, including Meditech and Epic, already have system downtime solutions built right in? And if they do, why would we need to work with Interbit data?
Well, I think that as I mentioned in the presentation, yes, most systems have some sort of protection, but it's not really optimized for all of the contingencies, and in fact can fall short, such as in the example where an application that is absolutely critical and relied upon is not part of the downtime structure provided by the vendor. So in the complex environment that we have today, there is no one solution for everything, well, except ours, but no. NetSafe has really been designed to work with any kind of system, and and to simplify that access, whether it's documents or databases, so that it can be securely stored whenever and wherever it's needed. So.
Great, thanks so much. So we do have another question that has come in. It says, what is the process for implementing Interbit data or a similar downtime solution?
Well, as with any downtime solution, you begin by a survey and identifying within your patient locations, within your departments, what in fact is the critical information. If you focus on, if you knew there was going to be a downtime, what is the information that you need? That's an excellent beginning. And what we will help you to do is to automate the collection and dissemination of that information so that it is actually available as a background process wherever and whenever you need it, including our ability to notify you if, in fact, there's a problem with distributing that information so that you're not caught unaware. So.
Okay, great. And we have a follow-up question to that. So does your downtime solution only provide access to the data in the event of these downtimes, or does it also allow users to document data while the downtime is still happening?
At the current time, we have focused on being able to view, but if people need to document, then they can print out the information, and it can be barcoded so that it can be scanned in. So something like an EMR is easily, or electronic medication administration record, is easily printed out, and then the user can, sign as appropriate or annotate as appropriate, and it can be barcoded to allow to expedite the process of reading that back into the system when the system comes back up. So.
All right. Looks like we have one more question. This is, I think, relating to COVID-19. So does Interbit allow hospitals to access patient information from temporary locations, such as was the case across the country with COVID, when people were setting up sort of temporary and different medical care locations? Is that something that Interbit allows for during a natural disaster or another pandemic situation like this?
Well, yeah, there's a couple of answers to that. First of all, the standard implementation is delivering information to where the patient is, and typically it includes levels of redundancy. So, the nurse station really only needs the information about their patients, but perhaps the pharmacy wants that EMR information about all the patients, or medical records may want that. So even in the typical implementation, there are various places where the information will be stored, as well as the server itself. The ability to share to the cloud or the web, gives you that ability to, instead of the information being pushed to where you are, it gives you the ability to go to where the information is. And our standard web access allows that. So it could be done through an intranet as well as internet. But again, it's a different model. First of all, we typically push the information, but in different circumstances, it's very easy to grab the information from where you are, along with all the required encryption, security, and all.
Okay. And does your solution handle downtimes for all applications, or is it only available for a certain set of applications?
Within reason, we can, isn't that an interesting word? We can secure any application. Now, where I say within reason, we're not going to be caching radiology images necessarily, certainly not of diagnostic quality. We typically focus on the operational information that people will need, or even to anticipate those patients who you have appointments with, in the next 24 hours. Maybe we would cache that information, but we're not trying to create another entire database of your information. But from an operational perspective, there's no technical limitation to what we're storing.
Okay, great. Well, I think that's all the questions that I've seen come through. So I just want to thank everyone again. Thank Arthur for presenting today and sharing this information with us, and thank everybody for attending. We're going to be emailing around a copy of the PowerPoint presentation to everyone who was in attendance today, so that you'll get a chance to take a look at that. So thanks again, and enjoy the rest of your day.
Thank you very much.